This is the presentation for influenza, the flu vaccination. My name is Alexander Arroyo.
I'm Ethan Peterson.
And I'm Micah Zon.
I will be clicking the next slide to continue our presentation.
Influenza or the flu. It is a contagious virus affecting the respiratory system. Common symptoms are fever, coughing, and fatigue, and they can last from days to weeks. There are three types of strains, and they are A, B, and C, with influenza A being the most virulent. And by cell, it can transfer from animals to humans. The flu can be spread by droplets. And why is the flu more effective during the winter season? In shorter days, winter time is a shorter day for sunlight, so it decreases vitamin D, and that weakens the immune system. And serious symptoms can lead to death.
Vaccine works. As mentioned in the last slide, if you are experiencing any symptoms of fever, cough, and fatigue, it is recommended to schedule a flu shot with your doctor. There are different strands of the influenza virus, and identifying which to protect against in the next flu season can take researchers 6 to 8 months. After vaccination, it can take about 2 weeks to reach peak antibody count in a healthy adult. There are three main types of vaccines for influenza. There are recombinant, attenuated, and inactivated, and each have their own advantages and disadvantages. Inactivated influenza is most common because it is safe and has low cost. Live attenuated mimics natural infection, but isn't recommended for immunocompromised. And recombinant is limited to only adults due to its low efficacy, but should be given to adults with any egg allergy.
Explanation of the vaccine's impact on society. Each year, it is recommended to receive an influenza vaccine. This is due to the vaccination in the immune system declining over time, as well as viruses are constantly changing and evolving. The influenza vaccination impacts society by reducing the number of flu illnesses, death rates, increasing health concerns, and lastly, schools and jobs absences. According to the Center for Disease Control and Prevention, the flu vaccination prevented an estimated 7 million influenza illnesses, 3 million influenza-associated medical visits, 100,000 influenza-associated hospitalizations, and 7,000 influenza-associated deaths. The impact of ages 65 years and older are more critical. For example, they are able to get pneumonia, are hospitalized, and it weakens their immune system, and lastly, worsens chronic complications. The flu vaccination is important for people 65 years and older due to the risk of influenza viruses having towards their health. The older you get, the more you are exposed and a higher chance of complications.
We list the common symptoms of influenza. A. Nausea, sweating, diarrhea. B. Fever, coughing, fatigue. C. Loss of taste, loss of smell, nausea. Or D. There are no symptoms. Correct answer is B. Fever, coughing, and fatigue.
At the graph on the left, it shows the rates of hospitalized patients at the end of the year 2024 in December. As you can see, adults 65 and older have a higher number of hospitalization. In the graph on the right, it shows the number of people catching the flu at the end of December 2024. In adults 25 to 64 are the highest ones.
It is important for a patient to have an understanding of what is going on inside their body. It is also important for them to know the type of illnesses that they could be infected by. A patient may get sick even with the influenza vaccine, but reduces severity of illnesses. Some side effects of the flu shot are listed on the bottom. Sorenesses, redness area of shot, headache, fever, muscle aches, fatigue, and nausea. Some side effects of using the nasal spray would be runny nose, wheezing, headache, cough, and sore throats. There are many other websites online that you could go look into to educate yourself on these certain problems. Looks like we have came to an end towards our presentation. This is the works cited page where you could find the articles and also the research on the influenza vaccination. It is very important for you to do your own research if you would like to know a little bit more about how the influenza vaccine works and also to see its data. Also, we would like to thank you for your time. If you guys would like to leave any comments and like the video, that would very much help this channel out. It has been a pleasure. Has been Alexander Arroyo.
Ethan Peterson.
And Mike Dazon.
All right, thank you and have a great day, and also take your